Now, we did highlight a lot of these particular risk factors that could lead to chronic conditions like heart disease and stroke. And I wanted to bring up really the elephant in the room, which is this COVID-19 virus, this pandemic, because obviously a lot of the risk factors we are addressing also place one at a higher risk for severe COVID-19 through hospitalizations or even death. As it stands right now, we know that the vaccine has been critical in reducing the number of severe hospitalizations as well as death, and it's done a phenomenal job in that forefront. So I wanted to talk a little bit about vaccines, but not just the COVID vaccine, also the flu vaccine, given the current season that we're in. And as cardiologists, we've always known the importance of getting the flu shot. Each and every year, we advocate it for our patients to do so. And in fact, I personally don't have my patients leave the office without asking if they receive both their COVID-19 vaccines, possibly their booster, as well as their flu shot. So Dr. Baker-Smith, can you briefly talk about why getting the flu vaccine is so important every year? And should we vaccinate our kids against the flu?
Oh my gosh, yes. As soon as the flu season, as soon as the vaccines are available, my kids are getting their flu vaccine. Flu vaccination is the best way to protect yourself and your loved ones against the flu, and it's potentially serious complications. CDC recommends annual flu shots, and that begins at 6 months of age and older. And this is really intended to reduce the spread of respiratory illnesses. And it's also important to highlight that we're trying not just to protect, the general population, but particularly some of our more at-risk population, which is like our older patients and more vulnerable patients. So it's really important. And especially during this COVID-19 era, some of the symptoms may overlap. So again, it's really just important to make sure that individuals are vaccinated against the flu.